Hi, this is Lauren Marms with Medicare Solutions Team. This video I will explain the differences between a Medicare supplement or Medigap plan and the Medicare Advantage plans. There's a lot of confusion between the two because people tend to call anything they have with Medicare a Medicare supplement, and that's not true. You have a Medicare supplement or Medigap, which has one type of coverage, and you have a Medicare Advantage plan, which is a private insurance company running your Medicare. And we'll go through all the differences, the copays, debunk a few myths, and we'll go over some frequently asked questions. As you can see, the common thread in most of my videos, we are starting with the Medicare and You handbook. The reason we're starting with this and why I use it in all my videos, because it is the official U.S. government Medicare handbook. When it comes to Medicare questions and answers, this is where they're found. When you sign up for Medicare, there are a couple different ways you can go. You have Original Medicare, Part A and Part B. Part A will be automatic. Part B, if you are not receiving Social Security benefits, you will need to sign up for 90 days out of turning 65 or when you'll be leaving your group policy, retiring. Original Medicare, you have your choice of doctors, hospitals, and other providers that accept Medicare. That's big. That means any doctors, any hospitals, any clinics in the United States that accepts Medicare is open to you. You have no network. You can also sign up for a Medicare Advantage plan. They are usually HMOs or PPOs. It is a private insurance company approved by Medicare that provides your coverage. In most plans, you need to use plan doctors, plan hospitals, and providers that are in their network. You will continue to pay your Part B premium, and the Medicare Advantage plan may have an additional premium. If you decide to get supplemental coverage is coverage that fills gaps in Original Medicare. It will pay the Part A deductible. It can pay the Part B deductible, although we don't recommend that. And it will pay the 20%. That is a true Medicare supplement. Your Medicare costs for Original Medicare, your Part B premium is normally $104.90. That can go up due to income. Your Part B deductible is $147 per year. And again, this can be covered by a Medicare supplement or Medigap. We don't recommend that because you're paying an insurance company more per year to cover that $147 than if you would pay it out of pocket. And that's another video. Medicare is also made up of a Part A. There is normally not a Part A premium if you have worked and accrued enough credits. Part A is given to you free of charge. Part A does have an inpatient deductible though. It is $1,260 this year for each year. And of course the co-insurance for Medicare is they pay 80%, leaving you with the 20%. As we discussed earlier, Medicare Advantage plans come in several different ways, but most of them are HMOs or PPOs. You notice it is a 0 per month premium. Some agents, and this is really a hot point, will say that this is free. No, it's not free. As anyone Medicare age should know by now, nothing in this life is free. It is a 0 per month premium. You will still pay your Part B premium, but you will have copays, and in certain instances, you will have the exact same co-insurance to pay of 20% as you would with Original Medicare. This plan, which is 0 premium, you have a $6,700 maximum out of pocket. That means with co-insurance, co-payments, if anything large happens, you will pay $6,700. For instance, the type of things that you will pay, an ambulance will cost you $300 under this plan, $150 under this one. Diabetic monitoring supplies, you will pay 20% of the cost. Outpatient surgery, 20% of the cost, again, is your co-insurance. Same as it would be with Original Medicare. Inpatient hospital, and this is where it gets expensive. They usually charge between $250 to $400 or $500 per day, day 1 through 4, 1 through 7. You're going to have a copay. This particular plan would be $430 copay per day of days 1 through 4. Chemotherapy. If you had chemotherapy or some other Part B drugs, you would be responsible for 20% of the cost. I don't see how that's free by any means. Now that we've looked at a typical HMO Medicare Advantage plan, let's take a look at the networks, what a HMO is, and what a PPO is. Again, we're back in the Medicare and You Handbook on page 76 this year, and it goes on to explain what the different types of Medicare Advantage plans are. The first one being a health maintenance organization, HMO. In most HMOs, you can only go to the doctors, other healthcare providers, or hospitals in the plan network. That means you have lost the right under original Medicare to see any doctor, any hospital, any clinic in the United States. You are now tied to the rules of the HMO and must see their doctors. You will need a referral, and with an HMO, other than emergency services, there are no out-of-network coverage. There is also the Preferred Provider Organization, or PPO, which you may have had when you had workplace coverage. In a PPO, you pay less if you use doctors, hospital, and other care providers that belong to the plan's network, but you will pay more if you use doctors out of network. Usually, the out of network is a 50% coinsurance. So once again, you no longer have what you have with original Medicare as far as networks and can see any doctor. You can see them out of network, but it's going to cost you. Now I want to go over part that I have seen firsthand, and I know a lot of agents that have had to move hundreds of clients during open enrollment because of this one fact. Providers can join or leave a plan's provider network anytime during the year. Your plan can also change the providers in the network anytime during the year. If this happens, you may need to choose a new provider. The reason you need to choose a new provider is because when you sign up for a Medicare Advantage plan, if you signed up for it as of January 1st, that is a 1-year contract. You can't just get out and leave anytime you want. You will need a special enrollment period. For instance, if you moved, you lost Medicaid, there are several of the special enrollment periods, but just because you want to change doctors isn't going to happen. You're stuck for 12 months. So that's a brief explanation of Medicare Advantage plans, how the free plans aren't really free. They're a zero premium, but could cost you thousands if something serious happened or you ended up in the hospital for an extended period of time. The one benefit that they do have over original Medicare is that they have a maximum out-of-pocket limit. Original Medicare has no limit. You'll pay 20% forever. Now for what we recommend for our clients, a Medicare supplement or a Medigap plan. They're very simple, very easy to explain. Again, the Medicare and You Handbook. Original Medicare pays for many but not all healthcare services and supplies. Medicare supplement policies sold by private insurance companies can help pay some of the healthcare costs that original Medicare doesn't cover, like copayments, coinsurance, which is your 20%, and deductibles, which we went over at the start of this video. Medicare supplement insurance policies are also called Medigap. Some Medigap policies also offer coverage for services that original Medicare doesn't cover, like medical care when you travel outside the U.S. If you have original Medicare and you buy a Medigap policy, Medicare will pay its share of the Medicare approved amount for the covered health care costs. Then your Medigap policy pays its share. You have to pay the premiums for a Medigap policy. It's that simple. Medicare pays its part, Your supplement pays its part and you're done. No networks. You go to any doctor, any facility in the United States that accepts Medicare. Medicare will pay their part, the supplement pays theirs. It doesn't get any easier than that. You don't lose your Medicare rights, you just supplement them. Now, when it's talking about what the Medigap pays, it'll pay your Part A deductible, Part B coinsurance or co-payment, the first 3 pints of blood, hospice care, skilled nursing, your Part A deductible. Your Part B deductible can be, but Plan G is the one that we recommend. Plan F is the other most popular plan. The Plan F will pay that $147, but you'll pay the insurance company to do that for you. Plan G, what we recommend, you will pay that $147 deductible out of pocket and still save money in the long run. They will also pay the Part B excess charges, which means if your doctor says he will accept Medicare as payment, but he is not assigned by Medicare, he can legally charge you 15% over Medicare costs. And what Medicare doesn't have is this foreign travel rider. It will pay 80% of the bill. There's usually a small deductible, and there is a maximum. This is for emergency situations only out of the country. And that pretty much covers it. A Medigap or Medicare supplement policy is that easy. In Wisconsin, Minnesota, and Massachusetts, they're set up a little different. Versus A through N, it has the base through riders, but it's just as easy. The riders cover these different parts. The base covers your 20%, and the riders will take care of your deductibles, your foreign travel, and your Part B excess. It's that simple. Hopefully I've given you enough information to make an informed choice. Of course, you can always contact us at our website, MedicareSolutionsTeam.com, or you can call us at 844-528-8688, and we'll be answering any questions you have. Thank you for watching our videos. Please subscribe to our channel. You'll get updates and notification when we put a new video on, and we'll talk to you soon.